Hello dear friends, today we are going to learn about rheumatoid arthritis. Now by watching this video, you shall be able to describe the etiology and pathogenesis of rheumatoid arthritis. You'll be able to name the sign and symptoms of the disease. You'll be also able to mention the complications of the disease, and lastly, you can suggest diagnosis and treatment for the same. Now first, before starting what is exactly rheumatoid arthritis, let us now see first of all what is joint. Okay, so joint is a part of our skeletal system where two bones they come in contact. What is the purpose of this joint? It allows easy movement and it also provides mechanical support. Now based on the structure and function, the joints are classified as the structural classification includes first class is fibrous joints. These are the bones. They are joined by tight, inflexible, dense connective tissue layer. That is, here the bone is not going to show any kind of movement. Second class is cartilaginous joint, that is also called as synchondrosis. It is connected by cartilage and it allows only a slight movement. And third is the synovial joint where the movement is maximum. The functional classification includes first class as synarthrosis joint, which allows no movement. The second is amphiarthrosis, which is going to give slight movement. And third class is the diarthrosis. It allows free movable articulation. Now, what is exactly rheumatoid arthritis? It is an autoimmune disorder. Rheumatoid arthritis occurs when immune system of the body it mistakenly attacks body's own tissues. It is a chronic inflammatory disorder. It is mostly going to affect more than one of your joint. It can damage a wide variety of the body systems along with your joints, which include the skin, eyes, lungs, heart, and blood vessels. Now, rheumatoid arthritis, it affects the lining of the joints, causing a painful swelling that can eventually result in bone erosion and bone deformity. The inflammation can damage other body organs, finally causing physical disability. Thus, it is a chronic systemic autoimmune inflammatory disorder affecting all joints and causes immune system to attack the joints. It can lead to loss of motility and joint destruction, ultimately making the person completely disabled. The rheumatoid arthritis affects 0.5 to 1% of the population worldwide, with a peak prevalence between the ages of 30 and 50 years. Now we'll take a look at its etiology. Now, rheumatoid arthritis, first of all, the etiological factor is gender. Okay, women before the menopause they are affected 3 times more often than men, with an equal sex incidence thereafter, suggesting an etiological role for sex hormones. The second factor is family history. There is an increased incidence in those with a family history of rheumatoid arthritis. Third factor is genetics. HLA class 2 is strongly linked to rheumatoid arthritis. HLA-DR4 is the major halotype in ethnic group, HLA-DR1 in Indians, and HLA-DW15 in Japanese. And the fourth factor is related to some exogenous factors which include smoking, infection, and trauma. Now, what are the risk factors for rheumatoid arthritis? The first one is the age. Women are at higher risk. Second is age. It can occur at any age, but it begins in middle age. Third is the family history. Fourth is smoking. And fifth is environmental exposure to asbestos and silica. So we'll take a look at the pathogenesis of rheumatoid arthritis. External antigens or endogenous antigens enter the body. It causes infiltration of T and B lymphocytes, cytokines, interleukins, tissue necrosis factor alpha, prostaglandins, proteases. It causes inflammation, proliferation, and degeneration of the synovial membrane, causing destruction of synovium and cartilage. Now, what are the symptoms? First of all, the onset of pain is very, very slow. Early rheumatoid arthritis tends to affect smaller joints first, particularly the joints that attach the fingers to the hands and toes to the feet. At this point, your joints, they are tender, warm and swollen. The joint stiffness that is usually worse in the morning and after inactivity for at least 30 minutes. The patient experiences fatigue, fever and loss of appetite. As the disease progresses, there is weakening of joint capsules, causing joint instability, subluxation and deformity ultimately. Now, what are the non-articular manifestations of rheumatoid arthritis? The first is, we can say, systemic manifestations. It includes fever, fatigue, and weight loss. Second is, it is related to eyes. At the eyes, it is going to cause you scleritis, scleromalacia, perforance, that is perforations of the eye. Third is neurological manifestation. It is going to cause you carpal tunnel syndrome, atlantoaxial subluxation, and cord compression. And fourthly, it is hematological. It is going to cause you lymphadenopathy, Pelti's syndrome, that is rheumatoid arthritis, splenomegaly, neutropenia, anemia, chronic disease, NSAID induced, and gastrointestinal blood loss. The pulmonary manifestations include pleural effusion, lung fibrosis, rheumatoid nodules, rheumatoid pneumococcis. Next is the heart and peripheral vessels related. It is going to cause you pericarditis, pericardial effusion, Raynaud syndrome. Next is related to your legs. It is going to cause you leg ulcers, nail fold infarcts, gangrene of the fingers and toes. You can see here. Then it is going to affect your kidneys. In kidneys, when kidneys are affected, it is going to cause you amyloidosis, causes the nephrotic syndrome and renal failure. So you can see here, these are the points which are highlighted at which point there are chances that rheumatoid arthritis is going to cause you pain. Now, what is the diagnosis? First of all, it is very, very difficult to diagnose arthritis in the early stage. Secondly, the physician is going to carry out some physical examination. He is going to inspect your joint swellings, redness, warmth, and reflexes, and muscle strength. Next, he will go for blood test. He will evaluate the blood test for erythrocyte sedimentation rate, that is ESR, or sed rate, or C-reactive protein CRP, which may indicate the presence of an inflammatory process in the body, rheumatoid factor RF specific antibody, anti-citrullinated protein ACP antibodies. Next, he might also perform some imaging techniques, tests like X-ray to help the track of the progression. Then he might carry out MRI and ultrasound to judge the severity of the disease. Now we'll take a look towards the treatment. Okay, first of all, it is very clear that there is no complete cure to rheumatoid arthritis. Secondly, now what you have to focus to reduce the symptoms. The first thing is you have to give the patient NSAIDs or COX-zips. They are effective in relieving the joint pain and stiffness of the rheumatoid arthritis. Then secondly, you can go for corticosteroids. They reduce the inflammation and pain and slow the joint damage. Next, you can give disease modifying anti-rheumatic drugs, DMARDs. It acts mainly through inhibition of inflammatory cytokines. 6 weeks to 6 months it takes to get healed from the onset of the disease. Next is, it also reduces the progression rate and saves the joints from permanent damage. The drugs which come under this category as are sulfasalazine, methotrexate, hydroxychloroquine. Okay, and lastly, you can go for therapy. You can hire a physical or occupational therapist who can teach exercises to help keep your joints flexible and healthy. The last resort is surgery. You can go for synovectomy. Now, what is synovectomy? It is surgery done to remove the inflamed linings of the joint called as synovium, and it can be performed on the knees, elbows, wrist, finger, and hips. Next is the tendon repair. Now, what is done here? Inflammation and joint damage causes the tendons around the joint to loosen or rupture. So, the surgeon is going to repair the tendons around the joint. Next is joint fusion. Surgically fusing a joint may be recommended to stabilize and realign a joint and for pain relief when a joint replacement isn't an option. And the last thing is you can go for total joint replacement. During joint replacement surgery, the surgeon removes the damaged part of the body and of the joint and inserts a prosthesis made up of metal and or plastic. Okay, so this was all about rheumatoid arthritis. Thank you for watching.